Today we are going to discuss sterile gloving. Sterile gloving is done for different procedures such as sterile dressing change and tracheostomy suctioning, along with other procedures. The first thing you want to do is collect your supplies, which would be a pair of sterile gloves in your correct size. You would then set them on a bedside table or a table that you could have room to open them up without contaminating, and you want to make sure that if it is a bedside table that you put it to waist level, because your chances of contamination then are less. You open up your package, and because it is sterile, it has a 1-inch folded border around it so that you can open it and touch the 1-inch border with your fingers. You will have to fold this paper back a little bit just so it stays open flat. Okay, so now we're ready to glove. With the first glove, we want to pinch. Pinch the cuff of the first glove. Pick it up off the table. You don't want it to be dangling and hitting the contaminated edge. You pick it up, you put your hand in there, and now you have your glove on one of the hands. Then you go ahead and with the second glove, you scoop that cuff. Being careful not to touch it with your thumb. The inside of the cuff is considered contaminated, so you do not want to touch it with your sterile gloved thumb. And this one you go ahead and put on the other hand, and there you go. Now, once you have your gloves on, you cannot fix them past your wrist. That is considered contaminated, so you are not going to pull them. You may adjust them up here on the hand part, and that would be okay. You now have donned sterile gloves.